everybody, welcome back to my channel. If this is your first time, welcome. Tonight I want to talk about Gloria Remeirez. Now I want to do this very respectfully because we have to remember in this story, this is a real woman who had a real family, and she shouldn't be remembered just for the way that she died. So, Gloria Remeirez was born January 11th, 1963. Gloria Remeirez was an ordinary woman living in Riverside, California, with 2 children and a husband. She was described by Reverend Brian Taylor as a friend to everyone she met and a joker who brought joy to others. After her death on February the 19th, 1994, and the events that followed, she unfortunately became remembered in the media as the Toxic Lady. About 8:15 p.m. on the evening of February 19th, 1994, Gloria, who was 31 and battling cervical cancer, was brought into the emergency room at Riverside General Hospital in Riverside by paramedics. Remeirez, suffering from several severe heart palpitations, was brought into the emergency department. She was extremely confused and was suffering from tachycardia, a heart rhythm disorder with heartbeats faster than usual, greater than 100 beats per minute. The and Cheyenne Stokes respiration, which is an abnormal pattern in breathing characterized by progressively deeper and sometimes faster breathing followed by a gradual decrease that results in a temporary stop in breathing called apnea. The pattern repeats with each cycle usually taking 30 seconds to 2 minutes. The medical staff injected her with the diazepam I'm not a medical profession. Midazolam and lorazepam to sedate her. When it became clear that Remeirez was responding poorly to treatment, the staff tried to defibrillate her heart. At that point, several people saw an oily sheen covering Remeirez's body, and some noticed a fruity, garlic-like odor that they thought was coming from her mouth. So, registered nurse Susan Kane drew blood from Remeirez and noticed an ammonia-like smell coming from the tube. She passed the tube to Julie Gorjeski, a medical resident who noticed manila-colored particles floating in the blood. At this point, Kane fainted and was removed from the room. Shortly thereafter, Gorjeski began to feel nauseated. Complaining that she was lightheaded, she left the trauma room and sat at a nurse's desk. A staff member asked her if she was okay, but before she could respond, she also fainted. Maureen Welch, a respiratory therapist who was assisting in the trauma room, was the third person to pass out. The staff was then ordered to evacuate all emergency department patients to the parking lot outside the hospital. Overall, 23 people became ill and 5 were hospitalized. A skeleton crew stayed behind to stabilize Remeirez. At 8:50 p.m., after 45 minutes of defibrillation, Remeirez was pronounced dead from kidney failure related to her cancer. A county health department called in California's Department of Health and Human Services, which met two scientists, Dr. Ana Maria Osorio and Dr. Kristen Waller, on the case. I'm sorry that I am butchering some of these names. They interviewed 34 hospital staff who had been working in the emergency room department on February the 19th. Using a standardized questionnaire, Osorio and Waller found that the people who had developed severe symptoms such as loss of consciousness, shortness of breath, and muscle spasms tended to have certain things in common. People who had worked within 2 feet of Remeirez and had handled her intravenous lines had been at high risk. But other factors that correlated with severe symptoms did not appear to match a scenario in which fumes had been released. The survey found that those affected tended to be women rather than men, and that they all had normal blood tests after the exposure. They believe the hospital workers suffered from mass hysteria. Okay. Korchinski denied that she had been affected by mass hysteria and pointed to her own medical history as evidence. After the exposure, she spent 2 weeks in the intensive care unit with breathing problems. She developed hepatitis and avascular necrosis in her knees. Riverside's coroner's office contacted Lawrence Livermore National Laboratories to investigate the incident. Livermore Labs postulated that Remeirez had been using dimethyl sulfoxide, a solvent used as a powerful degreaser, as a home remedy for pain. Users of this substance report that it has a garlic-like taste. Sold in gel form at hardware stores, it could also explain the greasy appearance of Remeirez's body. The Livermore scientists theorized that the DMSO in Remeirez's system might have built up owing to a urinary blockage caused by her kidney failure. Oxygen administered by the paramedics would have combined with the DMSO to form dimethyl sulfone. This is known to crystallize at room temperature, and crystals were observed in some of Remeirez's drawn blood. Electric shock administered during emergency defibrillation could have then converted the dimethyl sulfone into dimethyl sulfate. Dimethyl sulfate is a nasty chemical. Its vapors alone can kill cells in the eyes, mouth, and lungs when the body absorbs dimethyl sulfate. It causes delayed damage to the heart, liver, and kidney, convulsions, coma, paralysis, and even death. The vapors of this are harmful enough that dimethyl sulfate is classified as a war gas. The Classified Department of Defense's book reference on chemical warfare information had a report on dimethyl sulfate, the highly toxic dimethyl ester of sulfuric acid exposure, to which could have caused some of the reported symptoms of the emergency department staff. The Livermore scientists postulated on the new detectives that the change in temperature of the blood drawn from the 98.6 Fahrenheit of Remeirez's body to the 64 Fahrenheit of the emergency department may have contributed to the conversion. This, however, has not been confirmed. Some other theories regarding the death of Gloria Remeirez, the toxic lady, it's a horrible name, are more dramatic than a chemical reaction. Remeirez's family believes that the cause of death wasn't related to her cancer. The incident is a cover-up orchestrated by the Riverside General Hospital. The family cites an incident where a toxic gas leak occurred at the same hospital caused by a damaged piece of equipment. The Remeirez family also cited an incident when toxic sewer gas leaked into the hospital. However, the leak was sealed and the hospital was cleared to operate again. Now, it must be mentioned that the Remeirez family was mourning the loss of a daughter, mother, and wife, and at the same time having to deal with the apparent news that Gloria was toxic and harmed other people as she lay dying on a gurney. Finally, everyone's favorite theory, which is aliens. This theory is that the weird symptoms and the strange particles in Remeirez's blood are solid proof of alien abductions. But believe what you want, because a definitive explanation for the death of Gloria Remeirez has yet to surface. Her death and the incident in the ER might remain unsolved forever. 2 months after Remeirez died, her badly decomposed body was finally released for an independent autopsy and burial. The Riverside's coroner's office hailed Livermore's DMSO conclusion as the possible cause of the hospital worker's symptoms, while her family disagrees. The Remeirez family's pathologist was unable to determine a cause of death because her heart was missing, her other organs were cross-contaminated with fecal matter, and her body was too badly decomposed. On April 20th, 1994, 10 weeks after her death, Remeirez was buried at Olivewood Memorial Park in Riverside. And that is so tragic that on top of her family having to deal with her loss, that they also have to deal with the media and everyone coming up with this horrible, she's a toxic lady. I tend to believe it probably was a chemical reaction. The degreaser was and has been known to be used as a homeopathic remedy for pain, and with any kind of cancer, especially if she was in kind of late stages, which it seems like she was. She probably was in a lot of pain, and according to other reports, she wanted to be there for her children and take care of her children, and so maybe she did use it for pain. I don't know. I don't think her family will ever find a satisfactory answer. I would, however, question why her heart was missing. Before her autopsy was done and things like that, I don't know why. I don't know. It doesn't seem as though her body was treated very well after her death for it to be, that badly decomposed. and her heart missing, and fecal matter cross-contaminating. I mean, what were they doing with her body? That would be my one of my concerns as well, because that doesn't sound right. But God bless this lady, and I bless her family, because I'm sure to this day, especially her children and her husband, I'm sure she is on her mind every day. And we should remember, like I said, this was a real human. This was not and my interest is that it is a medical mystery. I mean, it's just strange, but I think there's probably more to the story that probably hasn't been released. But prayers go out to her family, and I hope that they have healed, and I hope one day they find the answers that they're looking for. So, if you like, this video and this kind of content, please like and subscribe to my channel. And if you know of any medical mysteries out there, let me know in the comments. Enjoy the shadows.